You will not be asked to stage or grade a cancer, but I just ask you to know that there are stages and grades of cancer that affect the type of treatment. This is a picture of different stages of colon cancer. Stage 0 is where you have abnormal cells located on the colon wall. Stage 1 means that they are starting to grow, and you can see as we increase in stage that the red lines are blood cells, are blood vessels. Angiogenesis is starting to occur, bringing nutrients and removing wastes from the tumor. By the time we get to stage 4, the tissue has metastasized and has spread to other organs. The screening test for colon cancer is the colonoscopy, and this can find tumors in early stages and remove them from the colon and prevent colon cancer from developing. Both stage and grade are important. It determines how aggressive the cancer is, the size of the cancer, and how much of the body it has affected. It also helps to determine what types of treatments are likely to be successful. For example, a low-grade cancer that resembles more healthy cells might have a wider variety of drugs that work against it. So the picture I just showed you on colon cancer, this is the number 3 cause of mortality from cancer in both men and women. Warning signs are blood in the stool. 90% of these cancers occur in individuals who are older than 50. Screening test for colon cancer is the ultimate master cleanse known as the colonoscopy. Okay, well, first we have a stool test where you take samples of the stool and it gets tested to see if there's any blood in the stool. A rectal exam where you have, yes, it's just what it sounds like, where a doctor wearing a glove will feel into your rectal area for any changes, for any lumps. But then there's the colonoscopy where the prep, well, ask your folks, they might know about it. But what happens during the colonoscopy is that a very tiny camera, after you have properly prepped for the test, is inserted into the rectum and looks through the colon for polyps. Polyps are clumps of cells that may represent dysplasia or cells that are starting to become cancerous. These can be removed during the colonoscopy. So this actually is a screening test that can help prevent cancer. Male-specific cancers include prostate cancer, which has no signs or symptoms in the early stages. It's often slow-growing. It can be diagnosed by the PSA blood test that I talked about at the beginning. The thing about the PSA is that it doesn't tell you if it's a slow-growing cancer or a fast-growing cancer. This puts men in a similar position that women are in terms of deciding what to do with results of screening tests. Testicular cancer is the most common cause of cancer, well, guys, in your demographic. Self-exam, in this case, may be the best exam that you can do in order to look for changes in the testicles. There are 3 types of skin cancers, and it depends on the type of tissue in which they originate. Basal cell cancer, squamous cell cancer, and melanoma. Melanoma is the one that spreads most quickly and can be most dangerous. Skin cancer is the most common type of cancer in the United States. Non-melanoma is highly curable. Melanoma is the most deadly form. But what I need to tell you is that melanoma, when found in its earliest stages, is highly treatable. Risk factors include sun exposure and tanning lamps. Those tanning salons increase cancer risk. Why are you going? Warning signs, these are put out by the American Cancer Society. These are the guidelines for detecting skin cancer or changes in cancer, changes in moles on the body. A stands for asymmetry. B stands for border irregularity. C, color. D, diameter greater than 6 millimeters. And E, that it is changing or evolving. One of the reasons why I suggest your demographic get screened for this type of cancer, it's not because I'm worried that you have skin cancer, But this, at your age, it may be helpful to know your moles from your freckles so that if there is a change, you can have it looked at. There are 3 clinical possibilities for treating cancer: curing it, in which the tumor and all cancer cells are removed; management, where tumor growth is periodically suppressed when the tumor growth goes into what we call remission, but it does come back and then the person is treated again until it again goes into remission; and terminal, when someone has terminal cancer, the primary goal is to relieve any symptoms and to offer them palliative care to keep them as comfortable as possible. Treatments include surgery, removal of tumors and nearby lymph nodes, chemotherapy. You don't need to remember the different types of chemotherapy, but they are designed to inhibit cell division. As we said, cancer is caused by cells refusing to die, that they continue to divide and divide. But some of the newer drugs may also inhibit new blood vessel formation, preventing that angiogenesis that I talked about, the formation of blood vessels that bring nutrients to the tumor and remove waste, thus allowing the tumor to grow. And radiation, which damages DNA of the more vulnerable cancer cells to stop it to grow. Unfortunately, healthy cells are also damaged, but hopefully they can recover. The thing about chemotherapy and radiation is that they both affect rapidly dividing cells. Chemotherapy is used if you have a blood or lymphatic cancer. Also, if there has been metastasis, because that means that the cancer has spread throughout the body. The goal of chemotherapy is to destroy rapidly dividing cells throughout the body. It's administered intravenously into the bloodstream, so it travels throughout the body, whereas radiation therapy is more targeted. The idea is that it is focused on the tumor itself. There are healthy cells that can be damaged, but again, the hope is that the healthy cell damage is minimized and they can recover and only the cancer cells are affected. Newer treatments, which are designed to hopefully minimize side effects. One of the goals of gene therapy, or one type of gene therapy, is putting genes into cancer cells themselves to make them more sensitive to the treatment the person is receiving. Immunotherapy or immune cell therapy uses the patient's own immune system to target the cancer cells. It uses the patient's own immune system to target cancer cells. So you're attaching antibodies to drugs that carry them specifically to the tumor without killing healthy cells. This has been revolutionary in the treatment of cancer. With immune therapy or immune cell therapy treatment, only the cancer cells are affected. The risk of destroying healthy cells is much less because the antibodies don't recognize healthy cells. They only recognize the cancer cells. In terms of guidelines for reducing your risk, you can look at these: activity and body weight, diet and nutrition, and special recommendations. Please take a moment to kind of stop and watch this guy and pay attention to the reality that there are a lot of unethical snake oil salesmen out there that want you to buy their treatments, take their pills, and they have no idea what you're doing to your body. This is cocktail chatter, but it may be helpful in terms of knowing what are some of the screening tests that are out there and what the current recommendations for how often they should be done. These next 2 slides contain the recommended cancer screenings. Understand again that I recommend for your demographic, this last one, the skin cancer screening, where you make an appointment with a dermatologist who can let you know the difference between your moles and your freckles and help you understand that if you see any changes, it might be something for you to look at. The assignment for this topic is another interactive body map. As always, please have a look at it and follow the instructions and email me a 1 to 2 page write-up on what you find out. Thank you.